Today, President Obama is going to ask Congress to approve his final budget proposal, and that includes $755 million for research, immunotherapy, combinations with therapy, and early detection techniques as well. It will also be used to focus on vaccines to prevent viruses that cause cancer. It's a lot to take in. So this morning, to give us an in-depth look at the research, what does this mean when it comes to finding a cure, is Dr. Matthew McCurdy from the Austin Cancer Centers. Good morning to you.
Good morning.
Thank you for being here.
You're welcome.
Let's talk about what you do, your job as a researcher, and what your first thoughts are when you hear how the president wants to have even more money poured into research.
This is great news for cancer researchers. Every little bit helps, and this extra total about $1 billion is something that researchers really are looking forward to.
You, a researcher yourself here in the Austin area, are you seeing advancements when it comes to finding a cure? Like we talked about many different cancers out there. Seems like somebody has been touched by a family member, a loved one, or themselves who have fought cancer.
There are many different types of cancers, and they all require different types of treatments. This is a very exciting time. Biologic agents and immunotherapy, cancer vaccines. So the more money we have to help go down these new avenues with grant proposals and incrementally investigate what's going to work and what's not going to work is going to be very helpful for cancer patients.
I was just asking you during the break, tell me about some success stories of how far we've come researching cancers and finding a cure. And you had a great one. You talked about former President Carter.
Jimmy Carter. So we have agents that trick the body into attacking the cancer as if it were, a germ. There are different types of, it's called immunotherapy. There are biologic agents. They attack specifically right onto the cancer cells. So these are both very exciting avenues. And then of course there's cancer vaccines, which if we can get that to work would be very exciting.
How close are we? When you say cancer vaccine, that blows the mind. How close are we to actually making that a reality? How would that work?
Well, it's getting the body to recognize this. The cancer cell has gotten the ability to evade detection by the body, by the host. And so if we can get the body then to recognize those cancer cells again as foreign, rather than evading detection, that would be wonderful.
Right.
And how long would that last if we get is it months? And then each cancer has different biology. It looks different under the microscope. So, it would take a while for it to be a reality for many types of cancers, but at least if we make these incremental steps, it would be very advantageous.
To know that hope is there, and the money, to know that the money is there. How expensive is it to do this research?
It is. They say it's about $1.5 billion to bring a new drug to market, so that puts it in perspective what the $1 billion will do.
All right, Doctor, we appreciate your time this morning. Thank you for all that you do.
Yeah, you're welcome.
Appreciate you.